Preganglionic parasympathetic neurons are located in cranial and sacral regions of the central nervous system. Visceral motor nerve fibers leave the central nervous system in cranial nerves 3, 7, 9, and 10, and in sacral spinal nerves S2, 3, and 4. Those neurons in cranial nerves 3, 7, and 9 innervate visceral structures in the head and neck. Those in cranial nerve 10 innervate viscera mainly in the thorax and most of the abdomen. Those in S2, 3, and 4 innervate viscera in the remaining parts of the abdomen and in the pelvis and perineum. Let's consider those visceral motor fibers carried in 3, 7, and 9. Parasympathetic preganglionic visceral motor fibers carried in 3, 7, and 9 leave these nerves and synapse in ganglia associated with cranial nerve 5. Postganglionic fibers hop onto branches of cranial nerve 5 to get to their target tissues. Parasympathetic fibers in 3 are carried by branches of V1, or the ophthalmic nerve, that enter the eyeball and innervate sphincter pupillae and the ciliary muscles. Fibers of 7 are carried by branches of V2, or the maxillary nerve, and V3, the mandibular nerve, to innervate glands of the orbit, nasal cavities, and most of the oral cavity. Fibers in 9 are carried by a branch of V3 to the parotid gland. Preganglionic visceral motor fibers carried in cranial nerve 10 leave the nerve in special visceral branches that innervate viscera in the neck, thorax, and most of the abdomen. These nerves synapse with the enteric nervous system in the walls of the gut, or with postganglionic neurons in ganglia associated directly with the organ. Vagal innervation to the gut ends just prior to the left colic flexure. Preganglionic visceral motor nerves carried out of the central nervous system in S2, 3, and 4 leave the ventral rami of these spinal nerves as pelvic splanchnic nerves that enter the lower part of the prevertebral plexus. These preganglionic fibers synapse with the enteric nervous system in the walls of the colon, distal to the region innervated by 10, and synapse with postganglionic neurons in ganglia associated with the walls of pelvic and perineal viscera.